and in media stories. The president sometimes does that too. So I want to be very clear that what I'm talking about is a bipartisan working effort that health care itself, not just health insurance, is too expensive. Health insurance has gotten a lot of attention lately. The president tweeted earlier this week, quote, deductibles in many cases are way over $7,000, making it almost worthless or unusable, he said. I agree. High deductibles tied to high premiums make health care inaccessible to too many Americans. And I know that the president is looking at ways to give Americans more affordable health insurance and to protect patients with pre-existing health conditions, and I look forward to hearing his plan. But the truth is the cost of health insurance will not come down or even grow more slowly unless we lower the cost of health care. You can't have low-cost health insurance when you have high-cost health care. And so my top health care priority this Congress is to enact legislation that will give all Americans an opportunity for health outcomes and health experiences at a lower cost. Democrats and Republicans are working together on that to get a result. That's why Senator Murray, the lead Democrat on the Senate's Health Committee, and I are working with Senator Grassley and Senator Wyden, the senior leaders on the Senate Finance Committee, which shares jurisdiction over health care. We're working together on developing specific bipartisan steps to help deal with the startling fact, which has come by experts who come before our health committee, that up to half of what Americans spend on health care is unnecessary. That's according to Dr. Brent James of the National Academies in testimony before our committee. In order to help do that, last December, in order to help focus on reducing health care costs, after the Senate Health Committee held 5 hearings on reducing the cost of health care, I wrote a letter to the American Enterprise Institute, the Brookings Institution, governors, state insurance commissioners, doctors, patient groups, academic experts, and the public, asking them to submit specific recommendations to Congress to lower health care costs. As of the March 1st deadline for response, we received over 400 recommendations, some as many as 50 pages long, and I want to talk about some of those today. But before I do, it's important to know that the cost of health care, in effect, has become a tax on the budgets of families, employers, the federal government, and state governments. Warren Buffett has called the ballooning costs of health care a, quote, hungry tapeworm on the American economy. Almost every day I hear from Tennesseans concerned that health care is too expensive. For example, Sherry from Hermitage, Tennessee, wrote me about her daughter's family and said, they're new parents. They spend almost as much as health care premiums as they do on their mortgage payments. That doesn't include the out-of-pocket expenses, such as co-pays and deductibles, Sherry said. Many people worry about a surprise billing, which is when a patient receives care at an in-network hospital, but an out-of-network specialist, like an anesthesiologist, for instance, also treats the patient. Todd is a father from Knoxville, Tennessee. He recently took his son to an emergency room after a bicycle accident. The son was treated. Todd paid a $150 copay because the emergency room was, quote, in-network for his health insurance, and they headed home. So Todd was pretty surprised when he received a bill later for $1,800 because even though the emergency room was in-network, the doctor who treated his son was not. I hear a lot about the high cost of prescription drugs. Shirley recently wrote me from Franklin saying, as a 71-year-old senior with arthritis, I rely on Enbrel to keep my systems in check. My copay has just been increased from $95 to $170 every 90 days. At this rate, I'll have to begin limiting my usage in order to balance the monthly budget. I hear from doctors about administrative burden. Dr. Lee Gross, a Florida primary care doctor, testified at one of our hearings that insurance and government regulations were making primary care too expensive. Dr. Gross is one of the first direct primary care practice, he founded one of the first primary care practices. This is where a patient might pay $60 a month for an adult, $25 for the first child, $10 for each child after, and receive all their primary care, strep tests, vaccines, minor surgical procedures, and more. He calls it Netflix for healthcare. After you pay your membership, you don't have to pay for each episode of care. Dr. Atul Gawande, who is leading the Amazon Berkshire Hathaway Morgan healthcare venture, told me recently in a conversation that direct primary care doctors are a powerful group for driving improved outcomes in healthcare because the doctors take responsibility for the outcomes, the risks, and the cost to the patient. I also hear that the place where medical procedures are performed can make healthcare more expensive. For example, Michael from Johnson City shared that he recently had an endoscopy of his esophagus, a fairly common and routine procedure. He had the procedure at an outpatient facility, which typically is less expensive than a hospital. However, the procedure was done as being billed at the hospital. Now, Michael is on Medicare, and he wrote to me saying, quote, "Not only am I charged a higher hospital rate, but taxpayers are charged a higher rate as well." I imagine that every senator has heard similar stories from people in their states and wants to do something about reducing the cost of health care. In order to the more than 400 comments we received, American Enterprise Institute and Brookings sent us a detailed list of 18 specific policy recommendations. Some of these the Senate Health Committee can work on. Some of these fall under the jurisdiction of other committees, and some are steps that the administration itself can take without congressional action. My staff and I are still reviewing all these, but I wanted to mention some of them today. One reason why health care is so expensive is that the cost is in a black box. Patients just don't know how much a particular test or procedure will cost. That makes it nearly impossible to adequately plan for future health care expenses. And because of that, the healthcare system does not operate with the discipline and the cost-saving benefit of a real market. Congress has already taken some steps to increase transparency. For example, last Congress, we passed and the President signed legislation by Senator Collins of Maine to ban the so-called gag clauses in pharmacy contracts that prevented pharmacists from telling a patient that a drug is cheaper if you pay with cash instead of your insurance. And now we've received recommendations on how to build on that first step. For example, patients shouldn't be prohibited from knowing the cost of a surgery or doctor's visit in advance of scheduling the procedure or appointment. And insurers and employers should not be prohibited from providing patients with information recommending lower cost options or higher quality providers. Another recommendation, Mr. President, this one from AEI and Brookings, is that employers contribute claims data, which is information on how much a test or service costs and how much insurance is paid for it, to what is known as an all-payer claims database. 18 states currently have these databases, so employers and insurers can see trends in healthcare spending. This would help break open the black box around the claims data for the 181 million Americans who get their health care on the job. One of our new Health Committee members, Senator Braun of Indiana, owns a manufacturing company and a distribution company. He employed over 1,000 people before he became a senator, and he was aggressive about helping his employees reduce health care costs. Healthcare Blue Book, a Tennessee company that testified at one of our 5 hearings on how to reduce health care costs, recommended we look at the clauses in contracts employers sign with insurers that block the employer from accessing de-identified claims data that they could use for purpose of price and quality transparency. The Trump administration is also focused on transparency. For example, Secretary Azar has proposed a regulation to start requiring advertisements for prescription drugs. Make sure they include the list price and ask for feedback on the idea of requiring that the prices patients pay for medical services also be disclosed. Another strategy for achieving better outcomes and better experiences at lower costs is to focus on the 300,000 primary care doctors in our country. Dr. Sapna Kripalani of Vanderbilt testified at one of our healthcare cost hearings that primary care providers are the quarterbacks of healthcare. By coordinating a patient's care, managing their chronic diseases, and providing other preventive care, primary care doctors are able to help patients stay healthy and out of the emergency room. Adam Bowler, who leads the Centers for Medicare and Medicaid Services Innovation, told me that while primary care accounts for only 3 to 7% of healthcare spending, it can affect as much as half of the spending. One recommendation we received from Dr. Gilliam, a primary care doctor in West Tennessee who runs a primary care practice, the same type of practice I mentioned earlier that Dr. Gross runs, was this. Dr. Gilliam said, direct primary care is the only model that's able to offer affordable health care with complete price transparency. One suggestion we have heard is to change Internal Revenue Service rules that block Americans from using their health and savings accounts to pay for the monthly direct primary care fee. And then there's drug pricing. Many recommendations are focused on reducing what we spend on prescription drugs, which is about 17% of all healthcare spending. One way is reforming prescription drug rebates, the discounts that pharmacy benefit managers negotiate with pharmaceutical companies. The Trump administration has proposed a new rule for the $29 billion in rebates on prescription drugs that the government pays for through Medicare Part D. One recommendation is to expand that to the estimated $40 billion of rebates negotiated in the private market. Then another way to lower drug prices is to increase competition through generic drugs, which can be up to 85% less expensive than brand drugs when there are multiple approved generics. I've heard concerns about brand drug companies not providing generic companies the samples needed to make generic drugs, and other ways that brands delay drug competition. It was recommended that we increase competition for the generic version of biologic drugs, which are called biosimilars. One way to do that may be a bill Senator Collins introduced last week to ensure that biosimilar manufacturers have access to the information they need to develop and bring to market more biosimilars. And then surprise billing. AEI and Brookings also recommended we focus on helping to eliminate surprise medical billing, which is what happened when Todd of Knoxville took his son to the emergency room. AEI and Brookings said that the issue is not that insurance companies have limited doctors and hospitals in their networks, but that, quote, emergency departments and ancillary physicians, as well as hospitalists and ambulance companies, have a lucrative out-of-network billing arrangement unavailable to other providers, unquote, which encourages doctors to go out of network and send patients high bills. Senator Cassidy, Senator Hassan are leading on a way to help eliminate surprise billing. We received comments about the importance of the seamless exchange of information between electronic health records. That includes stopping information blocking, a goal of the 21st Century Cures Act, a bipartisan bill that Senator McConnell said was the most important bill of the last Congress, was to make it easier for patients to access their health care records and for doctors and hospitals to get the information they need to treat patients. Last month, the Department of Health and Human Services released 2 proposed rules required by the Cures Act to lead better coordinated care and less unnecessary health care. We held a hearing on those last week. We heard a story of the better experiences and outcomes that can happen when healthcare records are interoperable. And finally, consolidation of healthcare. We received comments on the decreasing choices and competition in the healthcare system, which is when hospitals merge with doctors' offices or other hospitals, insurers merge with other insurers, or hospitals and insurers merge, so that these hospitals or insurers have even more control over the market. Some argue that consolidation in healthcare can benefit patients and lower costs. Others say that gives patients fewer options and healthcare prices increase. AEI and Brookings suggested that one way to address the potential negative consequences of consolidation would be improving oversight of the 340B drug discount program, which has been found to incentivize hospitals to purchase physician practices or employ physicians directly to bring in additional revenue from the 340B discounts. This echoes what we heard at our committee hearing. Today, I'm also asking that other senators continue to come forward to Senator Murray, to Senator Wyden, Senator Grassley, and to me with their specific proposals for how we can reduce health care costs. What I hope to do is compile the proposals that fall under the jurisdiction of our Senate Health Committee into a package of legislation that the committee will vote on early in the summer. We can then combine that with whatever the Senate Finance Committee passes and ask the leader to put it on the Senate floor and work with the House to send legislation to the President's desk. Secretary Azar this morning, in a hearing before the Appropriations Committee, reiterated his support and the President's support for this bipartisan process to reduce health care costs. My staff and I will continue to review recommendations and work with other members to incorporate ways to give Americans like Sherry, Todd, Shirley, and Michael better outcomes and better experiences at lower costs. Thank the President and yield the floor.
Senator for Virginia.
Mr. President, I'd like to make remarks as if we're in morning business.
Without objection.
Thank you, Mr. President. 2 weeks ago, after almost 2 years, Special Counsel Mueller filed his report with the Attorney General. The Attorney General sent us a short letter summarizing the major findings of the report. Simply put, a summary is not going to cut it. The Attorney General's own letter discusses the vast extent of the Special Counsel's investigation, mentioning over 500 witness interviews, 2,800 subpoenas, 500 search warrants, 230 orders for communication records, and almost 50 orders for pen registers, and actually 13 requests to foreign governments. This is an extraordinarily extensive investigation that yield a rich collection of facts about Russia's attack on our democracy. The American people deserve to see the results so they can judge the facts for themselves. We know from court filings, news reports, and the Senate Intelligence Committee's own investigations that the Russians attempted to influence the Trump campaign in many ways. At least 17 individuals in the Trump orbit had over 100 publicly released contacts with Russian officials or intermediaries. And yet, with all those 100 contacts during the midst of a campaign, somehow not one of those individuals, even those contacted with explicit offers of assistance from a hostile government, called the FBI to report those offers. And yet, the Attorney General's 4-page summary of this sprawling investigation, a summary that, according to press reports, may not even accurately reflect the Mueller report, focuses almost exclusively on the criminal portion of the Mueller probe, with barely any mention of the Special Counsel's counterintelligence investigation into these contacts. The Senate Intelligence Committee, the only bipartisan counterintelligence investigation still standing, has documented extensive efforts by Russians to reach out to those around then-candidate Trump. A few examples we have documented and have been in the public domain: candidates Trump's efforts to negotiate a business deal to build what was going to be called the largest building in all of Russia, negotiating on that deal throughout the whole primary process, and even potentially, at least according to his attorney, Mr. Giuliani, maybe negotiated all the way through the election. Data that may in itself not have violating laws, but I frankly think if I was a Republican primary voter, I would have liked to have known that my potential presidential candidate was still trying to do a deal with Vladimir Putin's government. We also, in our investigation, have exposed ongoing communications between the president's campaign chairman, Mr. Manafort, and Konstantin Kilimnik, who has ties with both Russian intelligence and the oligarch Oleg Deripaska. Our committee has made multiple criminal referrals to the special prosecutor based on what we learned in witnesses' efforts to lie to us and obstruct our investigation. This is what a counterintelligence investigation is all about. We need to fully understand what the Russians were trying to do, and we need to be able to warn future campaigns and candidates about the lengths and the new tools that hostile governments will go to undermine our democracy. Now, I believe we can't make that full guidance to future campaigns without a full release of this report. Now, some observers have said that the report cannot be released without jeopardizing sources and methods. Let me be clear. As Vice Chair of the Senate Intelligence Committee, no one is more sensitive to those concerns than I am. But the resolution that we have specifically states that the report should be released to the public in accordance with the law. Clearly, sources and methods would not be released under this standard, nor would grand jury information. What we're talking about here is basic transparency. Let's make sure the full Mueller report is released to Congress, including the underlying documents and intelligence, and then let's make sure that the American people see as much of this report as possible and as soon as possible. And let's do it in that bipartisan way to protect sources and methods. Therefore, Mr. President, I ask unanimous consent that as if in legislative session, the Senate proceed to the immediate consideration of H-Con Res 24, expressing the sense of Congress that the report of Special Counsel Mueller should be made available to the public and to the Congress, and which is at the desk. Further, that the concurrent resolution be agreed to, the preamble be agreed to, and the motions to reconsider be considered made and laid upon the table with no intervening action or debate.
Is there objection?
Mr. President,
The senator from Kentucky.
reserving the right to object, I'm all for transparency. I think we should know as much about this investigation into the president as we possibly can. We do know that we only know part of the story and that the Mueller report is only part of the story. What we also need to know is how this originated, because I think it's very important that we not turn our country into this back and forth where each successive party tries to use the apparatus of government to investigate the previous president. We do know now that the investigation of the Trump campaign reached to the highest levels of the White House, all the way up to President Obama. What we don't know is, was President Obama told that the evidence to get this investigation started was paid for by the Hillary Clinton campaign? We need to know that. So that's not part of the Mueller report, but that's something that I'm asking that we should attach to this resolution. We need to know, was President Obama told that this information came from the Hillary Clinton campaign? We do not yet know whether or not John Brennan was involved and to what degree. We do not know whether or not John Brennan colluded with British spy agencies to spy on Americans. It's illegal for our CIA to spy on Americans. We don't yet know whether or not John Brennan was colluding with British spy agencies and other spy agencies to get them to do his dirty work. We do know now that John Brennan, who had the power to listen to every American's phone call, who had the power to listen to every person's phone call in the entire world, we know that he is a rank partisan. We now know that John Brennan has called the president a traitor, essentially saying the president should be put to death. This is the guy that was in charge of this investigation. This isn't an objective person. We need to know about all of the communications. So I'm asking unanimous consent that we modify this resolution and that we find out and gain access to all the communications between Comey, Brennan, and Clapper, and the White House, and President Obama, because I don't want to ruin this great country with politically motivated investigations year in and year out. This had to do with placing spies and infiltrating the Trump campaign. Do you really think that our intelligence agencies should be infiltrating each other's campaigns? I don't want this to happen to a Democrat. When President Trump came to the Hill a week ago, he says, this shouldn't happen to the next Democrat president. We should not misuse the power of our intelligence agencies to go one party after another. How can we get on with the people's business if we're allowing the government to be consumed with this kind of stuff? So I ask unanimous consent that we amend the resolution and that we look at the entire story, not just the investigation, but how we got here. The media wouldn't even print this fake dossier. It was so scandalous and so unverified and has been turned out to be untrue, and yet this was the basis for beginning the investigation. This was the basis for doing something extraordinary, implanting spies and informants into the Trump campaign. So I ask unanimous consent that we amend the resolution and that as the Mueller report comes forward, we also come forward with all of the communications between the people who got this started, and we discover once and for all whether or not these people misused their office in starting this investigation.
Does the senator from Virginia wish to modify his request?
Reserving the right to object, I would simply point out to my colleague from Kentucky that the intelligence community, in their January 2017 report, reached a unanimous conclusion. That conclusion was that Russia massively interfered in our elections. They did it in forms of hacking into personal information and releasing it subjectively. They did it in terms of at least touching the electoral systems in 21 of our states' election systems in ways that, frankly, found a great deal of vulnerabilities. And they did it in ways that manipulated social media that, quite honestly, caught our intelligence community and the social media companies off guard. Our intelligence committee spent a year reviewing the conclusions of the intelligence community, and in January of 18 unanimously agreed that the intelligence community's findings were correct. The Russians interfered. They did it on behalf of one candidate, Mr. Trump, against another candidate, Ms. Clinton. And for those reasons, I respectfully object to my colleague from Kentucky's.
Is there objection to the original request? Senator from Kentucky. Objection is heard.
Mr. President, I'll simply close out. I hope we can move past this. The President himself has called for the release of the report. The House, in a rare stroke of unanimity, voted 420 to 0. I think many in this body would like to move beyond this issue, and the only way we're going to be able to move beyond this is to get this report released, get it out to the American public, let those of us who are charged with the intelligence community responsibilities see all of the report, including the underlying documents. I hope we can get to that point. Thank you, Mr. Chair. Mr. President, I yield the floor.
Mr. President.
Senator for Wyoming.
Thank you, Mr. President. Mr. President, yesterday, the NATO Secretary General Jens Stoltenberg addressed a joint session of Congress, the first Secretary General to ever do so. The Secretary General's in Washington this week, marking NATO's 70th anniversary. It's created after World War II. NATO is a political and military alliance of European and North American democracies. Since its founding in 1949,